Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that explores the recovery of a crucial hormonal system in our canine companions. The research, conducted by Francesca Del Baldo and colleagues at the University of Bologna and the University of Parma, investigates how the hypothalamic-pituitary-adrenal axis, often referred to as the HPA axis, recovers in dogs after they have been treated with intermediate-acting glucocorticoids. As many of you know, the HPA axis is a vital network involving the brain's hypothalamus and pituitary gland and the adrenal glands. This system plays a central role in managing the body's response to stress and regulating various bodily functions through the production of cortisol. Glucocorticoids are powerful medications frequently used in veterinary medicine to treat a wide range of conditions, including allergies, inflammation, and immune-mediated diseases. These drugs mimic the effects of cortisol and can be very effective in alleviating symptoms. However, a well-known consequence of administering glucocorticoids is the suppression of the dog's own HPA axis. When the body receives external glucocorticoids, the natural production of cortisol can decrease because the hypothalamus and pituitary glands sense sufficient levels of these hormones in the bloodstream and reduce their stimulating signals to the adrenal glands. Understanding how long this suppression lasts after stopping glucocorticoid treatment is critical for veterinarians, especially when diagnosing other conditions like hypoadrenocorticism, also known as Addison's disease, where the adrenal glands do not produce enough cortisol on their own. Diagnosing hypoadrenocorticism can be challenging because its clinical signs, such as lethargy, vomiting, weight loss, and decreased appetite, can be quite general. The ACTH stimulation test is the primary diagnostic tool for this condition. This test involves measuring cortisol levels in the blood before and after administering a synthetic form of adrenocorticotropic hormone, or ACTH, which normally stimulates the adrenal glands to produce cortisol. In dogs with a healthy HPA axis, the cortisol levels should rise significantly after ACTH administration. However, if a dog has recently received glucocorticoid treatment, the suppressed HPA axis may not respond appropriately to the ACTH, leading to what is known as a false positive result for hypoadrenocorticism. This can result in a misdiagnosis and inappropriate treatment. Currently, there are no clear guidelines on how long one should wait after stopping glucocorticoid treatment before performing an ACTH stimulation test to accurately diagnose hypoadrenocorticism. Previous information on HPA axis recovery in dogs after glucocorticoid use largely comes from experimental studies conducted on healthy dogs. These studies have reported that the duration of HPA axis suppression can vary considerably, ranging from a few days to as long as 7 weeks after discontinuing the medication. However, the recovery timeline might be different in dogs with underlying illnesses, as their overall physiological state could influence the HPA axis. Additionally, in clinical practice, it is common to gradually reduce the dose of glucocorticoids over time, a process known as tapering, especially if the treatment has been lethal or involved high doses. The impact of such tapering strategies, particularly alternate-day dosing, on HPA axis recovery in a real-world clinical setting has not been extensively studied. To address these gaps in our knowledge, Del Baldo and her team conducted a prospective observational study involving 20 client-owned dogs that had been treated with intermediate-acting glucocorticoids, specifically prednisone, prednisolone, or methylprednisolone, for at least 1 week. These are commonly used oral glucocorticoids in veterinary practice for managing chronic diseases. The researchers aimed to determine the timeline for the HPA axis to recover in these ill dogs after the glucocorticoids were stopped. Their hypothesis was that the recovery time would vary between individual dogs, and that dogs undergoing an alternate-day tapering process might experience a faster recovery compared to those who did not. The study involved performing several tests at different time points after the dog's glucocorticoid treatment was discontinued. The initial set of tests, labeled T0, was conducted between 2 and 6 days after the last dose of the intermediate-acting glucocorticoid. These tests included an ACTH stimulation test, measurement of endogenous ACTH concentration, the dog's own ACTH production, a standard blood biochemistry profile, and a urinalysis. Subsequent testing was performed every 2 weeks, T1, T2, T3, and so on, until the dog's HPA axis was considered recovered. Recovery was defined as a post-ACTH cortisol concentration greater than 6 micrograms per deciliter. Now, let's move on to the findings of this important study. The results revealed that the median time for HPA axis recovery in these 20 dogs was just 3 days, with a considerable range from a minimum of 2 days to a maximum of 133 days. Interestingly, a significant portion of the dogs, 11 out of the 20, showed recovery of their HPA axis at the very first testing point, which was 2 to 6 days after stopping the glucocorticoids. By the second testing point, T1. Approximately 2 weeks after discontinuation, another 6 dogs had recovered. However, the study also highlighted the variability in recovery time, with 1 dog each recovering at approximately 4 weeks, T2, 10 weeks, T5, and 18 weeks, T9, after the glucocorticoids were stopped. Most notably, 2 out of the 20 dogs required more than 8 weeks to achieve complete HPA axis recovery. One of these dogs took a remarkable 18 weeks. The researchers also investigated whether the dose and duration of the glucocorticoid treatment had any impact on the recovery timeline. Surprisingly, their analysis showed that neither the total cumulative dose, the maximum daily dose, the average daily dose, nor the overall duration of treatment was significantly correlated with the time it took for the HPA axis to recover. This finding suggests that predicting HPA axis recovery based solely on these treatment parameters might be unreliable. This aligns with observations made in human medicine, where the extent and duration of HPA suppression after glucocorticoid therapy are not consistently predicted by the dose, duration, or type of glucocorticoid used. In addition to the recovery timeline, the study examined the relationship between HPA axis function and certain blood and urine parameters that are often affected by glucocorticoid treatment. They found that the activities of 2 liver enzymes, alanine aminotransferase, ALT, and alkaline phosphatase, ALP, were significantly negatively correlated with the post-ACTH cortisol concentration. This means that as the HPA axis recovered and the post-ACTH cortisol levels increased, the activities of these liver enzymes tended to decrease. This is consistent with the understanding that glucocorticoids can elevate liver enzyme activities, and these levels typically decline once the glucocorticoid treatment is stopped and the body's own cortisol production resumes. The activity of another liver enzyme, gamma-glutamyl transpeptidase, GGT, along with other parameters like haptoglobin, cholesterol, triglycerides, urine-specific gravity, and the urine protein to creatinine ratio, did not show a significant correlation with post-ACTH cortisol concentrations. The researchers suggested that the lack of a strong correlation with GGT might be due to the less consistent effect of glucocorticoids on this particular enzyme compared to ALT and ALP. Furthermore, the study found a significant positive correlation between endogenous ACTH concentrations and both pre-ACTH and post-ACTH cortisol concentrations. This is an expected finding, as the body's own production of ACTH is regulated by the levels of cortisol through a negative feedback mechanism. When exogenous glucocorticoids are given, ACTH production is suppressed. As these medications are discontinued and the HPA axis starts to recover, the negative feedback diminishes, leading to an increase in endogenous ACTH, which in turn stimulates the adrenal glands to produce more cortisol. Finally, the researchers compared the HPA axis recovery time in dogs that underwent an alternate-day tapering process with those that did not. Contrary to their initial hypothesis, they found no significant difference in the recovery time between the 2 groups. The median recovery time was 3.5 days for dogs with alternate-day tapering and 3 days for those without. This suggests that a gradual reduction in the glucocorticoid dose, even without being strictly on alternate days, might be sufficient for relatively rapid HPA axis recovery in most dogs. However, the authors acknowledge that further studies with a larger sample size are needed to definitively assess the impact of different tapering strategies on HPA axis recovery. The discussion of these results provides important insights into the clinical implications of glucocorticoid use in dogs. The studies finding that the majority of dogs experienced HPA axis recovery within a few days after stopping intermediate-acting glucocorticoids aligns with some previous studies conducted in healthy experimental dogs. However, the observation that 2 dogs in this study required significantly longer than 8 weeks for recovery highlights the individual variability and the potential for prolonged HPA axis suppression in some clinical cases. Notably, one of these dogs, case 11, took a remarkable 18 weeks to recover. The researchers further detailed the hormonal trends observed in this dog with prolonged recovery. For an extended period after stopping glucocorticoids, this dog had undetectable levels of cortisol both before and after ACTH stimulation, while the endogenous ACTH levels remained low or undetectable. However, at a later time point, the endogenous ACTH concentration dramatically increased, and subsequently, the ACTH stimulation test showed a subnormal but detectable cortisol response. This pattern underscores the importance of considering the possibility of a protracted HPA axis recovery and the potential for misdiagnosing hypoadrenocorticism if an ACTH stimulation test is performed too soon after glucocorticoid discontinuation. In such cases, the authors suggest that repeated ACTH stimulation tests and monitoring of endogenous ACTH concentrations might be necessary to confirm a true diagnosis of hypoadrenocorticism. The lack of correlation between the duration and dose of glucocorticoid treatment and the HPA axis recovery time in this study is an interesting finding that contrasts with some common assumptions. While the study's sample size might limit the ability to detect subtle correlations, these results suggest that individual factors beyond the specifics of the glucocorticoid treatment regimen may play a significant role in determining the recovery timeline. Anecdotally, the 2 dogs with the longest recovery times in this study had received glucocorticoids for the longest durations and at higher average daily doses, suggesting that with a larger sample size, these factors might indeed show some influence. The study also explored the relationship between body weight and HPA axis recovery, given some recent evidence suggesting that larger dogs might experience more glucocorticoid-related side effects. However, no significant correlation was found between body weight and the time taken for HPA axis recovery in this cohort of dogs. Again, the authors cautioned that the small sample size could contribute to this lack of observed correlation. An unexpected finding during the study was the exclusion of 2 dogs that were ultimately diagnosed with unitremic eukalemic hypoadrenocorticism, EH. These dogs presented with clinical signs suggestive of hypoadrenocorticism but did not have the typical electrolyte imbalances often seen in this disease. Their diagnosis was based on persistently low post-ACTH cortisol concentrations, high endogenous ACTH levels, and the absence of electrolyte abnormalities, even after glucocorticoid treatment had been discontinued several weeks prior. Both of these dogs had been treated with prednisolone for immune-mediated hemolytic anemia, IMHA. The researchers noted that the relatively high occurrence of EEH in this study population might hint at a shared underlying mechanism between hypoadrenocorticism and IMHA, both of which are suspected to have an immune-mediated component. The possibility of concurrent autoimmune diseases or a common predisposition is an important consideration in veterinary medicine. The authors acknowledge several limitations of their study. The small sample size might have limited the statistical power to detect subtle but real correlations. Additionally, the included dogs had a variety of underlying medical conditions and received different glucocorticoid treatment protocols, although all received intermediate-acting formulations. Furthermore, a majority of the dogs were treated for immune-mediated diseases, often requiring higher doses of glucocorticoids compared to those used for other conditions, which could have influenced the results. However, the researchers argue that this might also reflect the reality of clinical practice. In conclusion, this study provides valuable data on the recovery of the HPA axis in ill dogs after treatment with intermediate-acting glucocorticoids. The findings indicate that while most dogs recover relatively quickly, within a few days to a couple of weeks, a notable subset can experience prolonged HPA axis suppression lasting more than 8 weeks. This prolonged suppression can lead to false positive results on ACTH stimulation tests and potential misdiagnosis of hypoadrenocorticism if testing is performed prematurely after stopping glucocorticoids. Therefore, clinicians should be aware of the significant individual variability in HPA axis recovery times and consider this when interpreting ACTH stimulation test results in dogs with a history of glucocorticoid treatment. Waiting an appropriate amount of time and potentially performing serial testing in cases of uncertainty is crucial for accurate diagnosis and management. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.